we would want you to be very uh, involved and confident in offering your volunteering services. And for that, you will need to speak with conviction, and therefore you'll need to understand a little bit more and little in depth about how you could best, mm, encash your commitment onto this great forum called Bengaluru Navanirmana, Navanirmana Party. Okay, so we thank Shrikant and Monica and the rest of the team. And there were a few questions raised yesterday, which I promised to answer today. It was Mr. Shetty who raised some very relevant medically related questions as well. So when I give you the case examples of the plight of what the volunteers have been going through, I will address them. So not at the very end, but somewhere in the middle. So if Mr. Shetty is already on the platform, he can just hold his patience for a little while. So COVID has forced us to make our health a priority, which, as per the old adage of health is wealth, should have always been the case. But now we are revisiting the fact that health is indeed the wealth. Jaan hai to jahan hai, as our Prime Minister said. We reiterate the same point. And in a few days from now, when the vaccine stocks are available, I urge all the volunteers from the Navanirmana to create a new environment of a massive vaccination drive, which would get the jab into every citizen above 18 years, and that will be the beginning of our win. So the whole purpose of this presentation is some avenues for self-help, and primarily when patients are ringing you very desperately, the family members are ringing in a crisis for bed, for oxygen, and for further advice to connect with the doctor, etc., you would be the primary contact point on whom they will lean on for moral support, as well as the connects, as well as for the right kind of information. So it is very crucial that we as a volunteer group should not panic or create more chaos and create confusions. We have to understand how we may guide them in a very simple manner, because some of them can indeed avoid hospital admissions and some of them can delay the hospital admissions. Some of them will not get the beds and therefore they can't get into the hospital. But what can they do in the meanwhile? So saving lives will be a very crucial point, with some small but significant step that we as a group of volunteers would take. So when you get a call, it may be the patient himself or herself saying, I have these symptoms. When there are symptoms, please remember that please connect with a group of doctors. Now, I am in conversation with Shrikantji and group as to connect with our technology partners who would give a lead to seamless connections with the routine set of doctors who can guide them on the basics, and the expert set of doctors, which are few, and therefore it needs a filter before the patients reach them. So those who really need them would reach them. So we are going to be harnessing our energies in the right direction, but just hold your patience for the next 48 hours when we come back to you with a helpline of how we are going to stratify this. So if there are symptoms, needless to say that you have to see to it that they connect with the doctor. The caller may say that I have been tested positive, but I have no symptoms. So what shall I do next? So you have to guide regarding some of the key points, which are very crucial, which will not allow the progression of this dreaded disease. There can be a third large category. Somebody at home is positive, the others are not. So how do we deal with that? But let me place it on records that the second wave of COVID is quite different from the first wave, because with all kinds of cocktail therapies and the plasma donations, etc., the virus have gone smarter and they have muted, and there is a whole different infectivity pattern. Originally, in the first wave, if one person in the house was positive, the others stayed a little bit away or took the basic necessary precautions, the others would escape out of this. But now, no longer that's the situation. If one person is positive, very, very, very likely that all the 5 or 6 of them who are staying in the same house would turn positive whether they have symptoms or not. So it's crucial that you have to give some kind of basic guidance, not only to the person who is positive, but also how the others will deal with the situation. So let's just focus on the traffic signal system. If you, with your conversation and the data gathering, have gathered that they will go into the green zone, which means they require only home isolation, you are going to connect them with the doctors. We will facilitate the daily teleconsultations, and they are in a way can totally avoid the hospital administration, the admissions, but the responsibility lies on the doctor with whom you connect. But you should know which are the patients whom you will connect, and keep giving them a moral support that they are in the green and they should remain there, and they will really not need to seek and occupy the hospital beds unnecessarily. The amber zone, where the next level, where they will need a care center, where they will need the monitoring. Yes, that can be done on the teleconsultation, but they may also need an oxygen through an oxygen concentrator or oxygen cylinder, and some medications will have to be started double quick. The last and the worst of the category is you already recognize by the few things that you have gathered on the telecall that no, this patient needs absolutely an urgent and an imminent admission. And as Mr. Shetty mentioned yesterday, are they seeking help too late? Because oxygen saturation, which is the key, cannot drop suddenly with that. It must have happened over a period of few days where there was a disconnect, and they could have got more tests done, and they could have been alert and well been in the amber or green zone. But unfortunately, they have already landed in the red zone. He also asked about what are those tests and what do those tests mean? Because anybody and everybody just seeing the social media messages are doubling up as Dr. Google and telling everyone, oh, you got this, go and get a CT done. And everybody seems to know about RT-PCR, when it's to be done, about the CTs, about the blood tests, and interpretations and misinterpretations are sky high. And that is what is misguiding and creating more chaos. A vast majority of people still remember, though the second wave is highly infective, all the 5-6 people at home are getting infected, but most of them will be mild or asymptomatic. The ratio is about 80% asymptomatic still, even in the second wave. 10% will go to the amber, and the last 10%, 5% will go on to the red zone. So the green ones can be managed at home. There's no need to panic. Only a small proportion of all infected patients will need hospitalization. Volunteers are desperately seeking oxygen cylinders, oxygen concentrators, from where to get, how to connect. Nobody's picking up the phone. This is the plight as on today, but who needs it? And if you don't get it, what is the simple advice that you can give them so that they can stall in the intervening period till they get the oxygen cylinder, how they have to manage? People with comorbidities and the age, this is an absolute must in your data, because if those red flags are raised, please, please, please connect to the network of doctors as early as possible before they deteriorate. Vaccination is, because of the shortage, we are not able to do as much as we could have, but those who are already vaccinated really will need less and less possibility that they will go into the intensive care. So if somebody in the household is infected and they make a call to you, you have on your checklist the most important risk factors. If they're more than 60, if they have diabetes, if they have hypertension, if they're obese, if they've got all other major organ diseases, it's a problem. You have to alert them that today you're okay, but please get in touch with the doctor, and then we'll see what it goes. And which doctor they have to get in touch with also is becoming a challenge, because anybody is advising anything right, left, and center. We confess, and we need to get the trained doctors on this issue. It's not a rocket science. We are in the process of training a bunch of 100 doctors who will follow the protocols and give the correct guidance. Needless to say that that person needs to wear a mask, and rest of the family members also, though they are not infected, they absolutely have to wear the mask even in their own house, and try to stay away from each other as much as possible. Multiple household members can stay in the same house, but the distancing, hand washing, all those protocols have to be absolutely followed. And if there is an elderly at home who is positive, and you are the one who are taking care of that elderly, not only the mask, but if the plastic sheet like a visor, which the doctors and the nurses in the hospitals wear, if you can get hold of that, that's an ideal gear to wear, because your eyes, nose, and mouth is covered with that plastic shield, and you are getting close to that patient. Please, hand hygiene you maintain, and maintain a minimum contact time with that elderly in your house, or husband or spouse or anybody who you would be primarily giving them food or water, or just helping them with small clothes. Then you need to protect yourself as well. Uh, then when you say isolation, again, not to move out for work or shopping. Anyhow, the chief minister has announced a lockdown, so there's no question of a great shopping. But just taking a stroll in the apartment complex, going out for exercises, etc., is a complete no-no, because this is now declared by WHO as airborne. So you will be responsible for just becoming a super spreader. Please, please avoid that. And if anybody is at your door, let them knock the door or ring the bell and leave the items on the doorstep, and then step back, and then you pick up the parcel. These simple things have to be followed. And when you guide the patients, please tell them that oxygen saturation is the most important thing, and they cannot just get a symptom for oxygen saturation. They have to use a pulse oximeter. So there is a package that is available in many places, but from BNP also we can just facilitate, because Amazon people are in touch with us, and we will make a neat package of what really says it is. The ones who are selling it in other parts of the country, they have a pulse oximeter, thermometer, a sanitizer, mask, and the COVID symptom monitoring chart, visor, etc. So minimal things which are required. So if there is a positivity, the key thing is to check the oxygen saturation. So they can't do it without a pulse oximeter. So digital BP apparatus, many people may have. Glucometer to check diabetes, many people may have. But pulse oximeter, now many people have started having. But those who ring you up, you make sure that that's the least that they must have. And what else you should do? Today they may have no symptoms, but you have to keep monitoring, because remember, the first 5 days is the incubation. They have the virus within them, but the symptoms will take a while to manifest and get out there to give you a proper clue. So they have to, the first 2 days, no symptoms. The fifth, sixth day may be worse, or they may be running fever for all the 8 days, and that is a more serious condition. So in the initial data, whether they are 60 plus, whether it's a female patient and pregnant, because then again, our group of specialists have to come into the picture. The days since the symptoms have started, if it's 8-day fever, it means quite different from the 2-day fever. Whether they have already got the RT-PCR test done, or maybe at this point in time, they may have no symptoms and they may get away without having any symptoms even in the future. That is called asymptomatic. They are infected, but they are not in any kind of trouble. So fever, fatigue, shortness of breath, and drowsiness. Somehow feel very lethargic, and the parents of a child were spanking the child, saying that you're not attending your online classes, you all the time are lazy, you seem to be sleeping. And after 2-3 days, they recognize that it is the COVID positivity which is making the child drowsy. So all age groups are now in the second wave are getting affected. The third wave is likely predicted even worse. So be alert on these kind of symptoms. If anybody is at home and complaining of that, that is also a symptom that you need to pick. So when you get an opportunity to speak to one member of the family who is calling, please recognize that their head is not on their shoulders, because they are in a panic mode. They don't know what to do next. So you just tap the information about all other members in the family on these lines and guide them that they have to, if they have symptoms, they have to get in touch with the doctor. Otherwise, they have to at least make a note of what is what. And a list of comorbidities, diabetes, hypertension, previous cardiac disease, already repeatedly getting respiratory infections, all those go into the high risk zone. And so the basic thing, the hallmark for this is oxygen saturation. Please do recognize that the nose, mouth, and lungs, that is the track of the COVID-19 virus entry. So by the time it reaches the lungs, and the oxygenation is less than 90% 94%. They have to take a walk, even if it is fine before the walk, after the walk. That means when you exercise, your lungs need to supply the tissues with more oxygen. So after a 3 to 6 minute walk, if the oxygen saturation drops, that is the earliest clue that you will get that if the viral load increases, if more amount of the lung is affected, within 2 to 4 days, even at rest, the oxygen saturation is going to drop. So that is the key. So use of the pulse oximeter is absolutely the basic, educational drive, if I may call it, that the volunteers should do. And please ask them to walk for 3 to 6 minutes and re-monitor so that you won't miss the early cases. And the pulse rate also is to be monitored. Whether they're gasping for breath, if the patient himself or herself is talking, and whether the relative reports that they cannot complete the full sentence without a pause, they're pausing like that. That means they don't have any oxygen, they don't have any energy. They're in a desperate situation already and difficult to arouse from sleep because the brain has no oxygenation, means they will be very drowsy. So these things have to be noted. A must ensure, please send them a screenshot that they have to do this, and they have to, we may also create a whole team of nurse practitioners who may just monitor whether all of these are okay and then raise a red flag when these are not okay. So the pulse oximeter, the digital BP apparatus, the thermometer, all that you're given them in the package will come very handy, but they have to note this. Check the temperature every 6 hours, measure how many times they're breathing per minute. It's okay even if it's up to 25, though the normal is 12 to 16. Again, I'm coming back to the point that oxygen saturation with the pulse oximeter is really a must. Amazon, Flipkart, anybody would give it. No nail polish to be used, reading for 1 minute, and don't move the fingers when you're hooked onto the pulse oximeter. What is the principle of this, brother? Again, we go to the traffic signal, red, amber, green. If it's more than 95, well, they are in the green zone. And this is how the pulse oximeter shows. SpO2 is oxygen saturation, more than 95, yes, they're green, and you can also relax. But today they're green, tomorrow they may become amber or red. So make sure they have taken the reading again after a 3 to 6 minute walk, and this is not dropping. And make sure that day after day for about 2 weeks time, the oxygen saturation remains good, so they remain in the green zone. If it's anywhere between 91 to 94, they need to be pumped up with oxygen. This is the second category, COVID care beds with supply of oxygen and maybe some medicines when the doctor prescribes them. Less than 90, already it is the alert sign. And on the pulse oximeter, you will see this big reading here, that is the oxygen saturation. The smaller one here is the pulse rate, which I said should not cross about 120. And the graph comes in the rest of the area that is here, and this is the way they will hook onto the pulse oximeter. If you have a video call, you can even show it to them, and the fact that they should record it properly. If they move their fingers, it will sometimes go to 95, sometimes 90, and they will panic. The mental status is very important. As somebody yesterday also commented, the immune status is going down because they are so worked up and they cannot fight the thoughts within themselves. So please see that they do the correct things at the correct time. And this is how we expect the patients to record. Even in a notebook, even in the pencil, they're writing and they're sending us the screenshots of the time in which they've taken, the temperature, the pulse, the respiration, the BP, the oxygen saturation, after walking, how much it was, etc., etc. So this is absolutely a must. The question about the housemaids and the drivers. Yeah, if the housemaid is staying within your house, she is like any other household member. So that is fine. If then she has to take the same precautions anyway. But outside maid is coming, she is going to 4 other houses. She may carry the infection from anywhere. She must not be allowed to enter the house without a mask. And all of you should quickly wear the mask when she enters, and also stay in a separate room when she's cleaning the other room. These small practical points are very important. And ask her also to maintain the hand hygiene. And without the maids, it's fine, but many of us are not used to doing the household chores, and also the elderly who cannot manage without the maids, you have to let them in, but these due precautions have to be absolutely followed. These are the kind of packages that they are offering in the other parts of the country, and even in some parts of Bengaluru. Many of the corporate hospitals have tied up to the hotels where they give the video consultation, and the medicines are delivered at the doorstep, and the blood samples are collected, and they reach the further advice also. So most of the things which can be done digitally, as how we are conversing with each other today on the digital platform, let's exploit the technology to its maximum and see to it that connectivity is there digitally but not physically, and that is safe and in the interest of everybody. Now, coming to the key questions that were raised yesterday. Everybody is talking about RT-PCR. Yes, that still even today remains the gold standard. If RT-PCR is positive, it is positive. But if RT-PCR is negative, 3 out of 10 who actually have the virus in their body will still report negative. That's called false negative. It's negative, but it's a false report. That is an inherent problem in the way that the RT-PCRs are done. But if it's positive, it's 100% positive. It cannot come positive without the virus being in the system. But if it's negative, well, the virus could be there, but still it may belong to the 30%. So for every 10 RT-PCRs that you have, 7 who are positive are pakka positive. The 3 who are negative may be positive, but may be negative also. So false negativity is a given, but false positivity is not. So RT-PCR is a gold standard test. If anybody has got the RT-PCR done, even in the first 5 days, when they don't have any symptoms, when the virus has just gotten in there, in the incubation period, also the RT-PCR will be positive. But this is not rocket science, so I need my listeners to pay really an attention to this. I said from the nose to mouth to lungs. So the very first day or second day, the patient is ringing you up saying my RT-PCR is positive. Then you become the doctor and you say, oh, is it? Let's see if your lungs are affected. Go get a CT done. Okay. At self-request also, CT is being done in many places. General practitioners are requesting. Many medical practitioners who still need the awareness are requesting because they think, oh, this is affecting the lungs. So let's see your CT. If it's not affected your lungs, don't worry. Okay. So the second day the CT is done. Has the virus reached the lungs yet? Has it damaged the lungs? Does the CT show any changes? No. Second, third, fourth day, it will not show any changes. So fifth to seventh day, that is the zone where the lungs will start getting impacted. So many patients, what they're doing, they're getting the CT done too early. And then, keeping it under the pillow and saying, hey, my CT is okay. That means my lungs are fine. I have no danger at all. And they're very, very complacent. They're asymptomatic. By the fifth, sixth, seventh day, zoop, the oxygen saturation drops because that's when the lungs are affected. They have done the CT too early and they have missed the bus. So this is the ground reality and situation. And the scores of the CT, if it's more than 15, it's a very severe case. Large part of the lung is affected. Surely their oxygen saturation will be less and they need a lot of help. Whereas it's the ulta case in RT-PCR. The viral load is very, very high if the readings are low. But let's not get into too much of that. If they've got the RT-PCR and it's positive, then you need to be on double alert. If it's negative also, you need to be on the alert because it may be a false negative. Whereas CT report, if they present to you, please don't go by the CT report alone because unless it's done under medical supervision. In fact, the patient who is not having the high viral load may pick up a greater viral load by getting under the CT machine, which is being done for so many of the really infected patients. So let's not encourage the wrong trend. Two other things. This may look complicated, but actually it's quite simple because some of the patients who will ring you up may say, no, but my CRP is this and IL-6 is this. What are these? What is CRPF is police force. CRP is something which is a marker for inflammation. So this whole thing is infection, inflammation. If your body wants to fight the COVID-19, what it has to do? It has to produce tons of CRP. So if CRP is more than 100, your body is fighting it out. That means there's a huge viral load. The battlefield is big, soldiers are many, and they have to fight it out. So CRP is more means the patient is in more trouble. Same with IL-6. IL-6 is again an inflammatory marker. If IL-6 is more than 100, that means next workforce has been signaled by the body to fight the COVID. That means more number of soldiers are coming in, which means the viral load is more and they're fighting it out. So CRP being more, IL-6 being more, that category, even the oxygen saturation is not fallen yet, they are likely to have a fall. They are likely to get into ICU. Please start advising them to start looking for the beds. Maybe you may not advise, but you have to at least recognize that you have to put them in touch with the doctor quickly. Not everybody needs a doctor consultation, but these people will definitely need. So let me give you two case examples from our own volunteers. This is Arjit who had sent me this case saying, age is 75. So we have raised the red flag. Consciousness level is reduced. Another red flag. Extreme weakness, stammering. He cannot complete a sentence. Problem. SpO2, oxygen saturation is 65 or below. Again, very, very big red flag. Has he got the COVID test done? Yes, obviously you would expect that it is positive. So it is positive. Does he have other issues in his body which does not help him to fight? He has BP, he has sugar, he has heart conditions. Then what to do? It's anybody's guess that he will urgently need a ICU bed. But the question that was raised yesterday, can this all happen all of a sudden? I would say a strict no. There has been a delay in seeking help. There has been a delay in instituting the treatment, and therefore the deterioration has happened. It can happen rapidly, it can happen slowly, but at the first point, if you pick up, then it's the ideal thing to do. But the question about the steroids, etc., I'll come to it in the next case. So this is what we are re-emphasizing. Home isolation, be confident, everything okay, but the charts and the daily teleconsultations is a must. If we can get our volunteer workforce to double up for this green zone, which means 8 out of 10 patients, which means 80% of the patients, the volunteers are handholding, helping, and it's a great service that you would be doing. Starting to look for oxygen concentrators and oxygen beds, yes, that is the next 10 to 15%. That also is a lot of help. But the last 5%, please recognize our limitations as a BNP group, because we don't own a hospital. We don't have the liberty to block the beds just for nothing. And when a desperate patient seeks help, yes, we are trying our best. It's a moral responsibility, but we cannot set the expectations that we will anyhow get you the bed, because it is 30 beds available and 300 patients waiting in the queue. So by the time this patient deteriorates, he may be the 500th patient waiting in the queue. So you need to be very careful about that 5%. That 5% today is filling up our WhatsApp group at the maximum, but please recognize, as Shrikantji said, glass half full and half empty. Behind these desperate messages which are coming through the volunteers in our WhatsApp group, there are many, many who have been helped by our volunteer group. So let's pat our back for that 90% of the help that we have done. Keep your motivation on, keep going. Lage raho principle is what you have to follow, because you are not only helping that patient, but please find out about the other family members and guide them appropriately. This is another package that many hospitals, see, like Sparsh Hospital is a big hospital which is tied up with the hotel. Lalit Ashok Hotel is tied up with the Apollo group. So you can probably channelize the patient to Apollo. They will guide them to stay in a hotel for 2 reasons. One is they have a small house. They reported positive. Elderly parents are there. They cannot stay at home. They want to isolate themselves. So they go to this hotel. In the hotel, what happens? Somebody is visiting, one doctor is visiting every day or teleconsulting. All their vitals are being checked. Oxygen saturation is being checked. Nurse is there, stations for any emergency. sanitation is ensured, isolated bed is there, food is available, hotels to unit. So these kind of packages are now, there will be an affordable class. Even the middle class will stretch a little bit and afford, but we should also help them in giving this kind of information, because more and more corporate hospitals and also the connect with the corporate through the government beds are also happening in this chain of hotel as a hospitality industry and hospital as the medical care industries marrying together to help the patient. And so this is another example of like the shop and single occupancy at 6,000 per day, etc. With all these included. But here also remember the monitoring is a must. If they can do it at home, well and good. If they can't, if they want to isolate in the hotel, that's another option available, because here they're offering oxygen concentrators and cylinders as well. So if you recognize in your traffic signal system that yes, they are in the amber zone, ICU beds are not available, but they don't need the ICU. You can connect them through the hospital to the hotel, so that the loop is tied and the patient again comes back to their own home in the best of their health. So this is a busy slide, but I have purposely put it because, to give you an example, age is 66. So all of you will raise your hands and say, no, age is a problem, right? Then the COVID result is positive. Symptoms, since when? Since about 8 days, when this patient has got in touch with us. From 28th April, they're having problem, but they have gotten in touch only on the 4th of May. Saturation levels are now dropped to 70. Patient already knew the BP and diabetes. Patient is an oxygen cylinder? Yes. Okay. Now they require the ICU. They're searching for beds since about 3-4 days, but not available anywhere. That is the reality. So, coming to Mr. Shetty's question, I hope I have been clear enough to say any symptoms, refer to the doctor. RT-PCR positive, take it on face value, but RT-PCR negative, still be guarded. Don't reassure that, okay, RT-PCR is negative, nothing will happen, because it may be false negative. Third thing is, if they have got the CT done very early, or you don't take the liberty of just asking for CT right, left, and center, that is not going to be useful. If some blood records already the patient is having, please refer to the doctor so it can be interpreted properly. There was a question about steroids. At home also, nebulization of steroids. The steroids, when they're given, is when there is something called a cytokine storm. And what is a cytokine storm? I said the warriors are put into the battlefield to fight the virus. So there is a storm of the IL-6, CRP, everybody coming into your system, and that storm needs to be abated with the steroids. So that has to be the right medicine, has to be given at the right time, and it's usually given for a short duration, because you endlessly keep giving steroids, you will develop infections because of the prolonged use of steroids itself. And oxygenation has a very significant role, because you need to plug the oxygen deficit. LMWH is low molecular weight heparin. Many patients are guided to take this again, because all the clots sitting in the balloons within your own lung, they are the ones who are blocking the lungs and not allowing the oxygenation to happen properly. Somehow remdesivir has become very popular, but let me tell you emphatically that it too has a limited role. When it has to be given and to whom it has to be given, if you get a request for that, you may need to take a second opinion, connect the patient to the key doctor, which we are going to establish that system very soon. They will tell whether remdesivir, or just looking for remdesivir aimlessly is not the answer. And please remember the silent disease for 7 days, where the patient has not even monitored oxygen saturation, suddenly he collapses. Day before yesterday, oxygen saturation was 90. You could have done something about it. It was 85. You could have still done something about it, but nobody has seen, neither you nor the patient nor anybody. And by 7th day, 8th day, a rapid deterioration happens, and then they come on to our network and ask for ICU beds, which is the last 5%. That is like really, really pathetic, because we have missed the bus. So please remember, asymptomatic phase is the first 5 days. The first 7 days is called the window period. Right from day 0, when the patient doesn't have any symptoms, 5th, 6th, 7th day, they start developing symptoms. In both these phases, RT-PCR is the only test which is the gold standard. If it's positive, it's positive. Then 2 weeks later, there is a decline phase, and at the end of 4 weeks only, the patient will start becoming, not really infecting the others. So this whole course needs to be done. Some general advice which you must not miss your opportunity to give them this general advice. Please ask them to take plenty of water, checking the temperature, not allowing the temperature to cross 100. If they cross 100, anybody with common sense will give them a crocin, a paracetamol, because high temperatures, high cytokine storm, blasting and making the whole situation very dangerous is not to be allowed. Persistent fever is dangerous. So please, you can tell them to take plenty of hydration, tea, coffee, water, juice, whatever they like. And they have to monitor the urine color. If it's dark, that means they need to increase their fluids. Not to go out for exercises, but at home only, walk around the house, pranayama, whatever they want to do, because breathing exercises really help a lot and they have to get adequate rest. One simple common sense advice, which I want each and every volunteer to proactively raise this topic and speak to people about the positioning. If they are well enough to sit down, they have to lean forward and sit so that more oxygen goes to the back of the lungs or the base of the lungs. And if they are lying down, let them lie down ulta in the prone position, because it significantly improves the oxygenation to the lung. Every 2 hours, they have to change the position. Let them lie down on the side, let them lie down over their stomach, and this is the way they can place a pillow under their chest. And even pregnant women, we ask them to lie down ulta with the pillow on their tummy as well. This ulta pulta position is required only when their pulse oximeter shows that the oxygen saturation is less than 95. Simply when they're doing good, when oxygen saturation is more than 95, 96, let them walk around. Let them not all the time be lying down. That's not a good thing to do. So the amber, 90 to 95, 86 to 95, that is the zone where till they get the oxygen cylinder, till they get the bed, till they get help, this position significantly improves. 2 days, you may not get the oxygen cylinder. 3rd day, you're seeing the pulse ox is already showing you 94 plus. Then, the scale of the disease has not been too much and they have already recovered. There are doubts between oxygen cylinder and oxygen concentrator. Both will supply oxygen, so both are good. The oxygen cylinder, if it gets empty, you need to replace it. Oxygen concentrators, many apartment complexes, we are toying with the idea of guiding them to buy 2 oxygen cylinders, like the swimming pool facility, like the gym facility. The day will come, and it's not very far away, that this apartment complex has 2 oxygen concentrators, and this facility is available here. So any apartment reports that they need an oxygen cylinder or an oxygen concentrator, it goes there on rental basis, and then once a patient gets well, then it can be shifted on with others. Oxygen concentrator works only on electricity, and it is to be charged, and it will drive 5 liters, 10 liters oxygen. So it's a via media, and whenever the oxygen cylinders, nowadays they're keeping at home also, they're not aware, they will pray and keep the diya or the lamp also, they're highly combustible. You're providing oxygen cylinders and you're not guiding them to take care of the environment around that oxygen cylinder. It can lead to more danger. So please tell them that oxygen does support combustion and cause fire. Keep it away from the kitchen. Keep it away from the candle flame or diya, or no smoke is allowed in that room. Even the smoking is not allowed, because that's dangerous. So if the oxygen saturation is below 94, especially after walking, if it's below 94, then extra supply of oxygen is needed, because the lungs can. And please remember, within 2-3 minutes after giving the oxygen, the improvement has to happen. And it does happen. And even in the prone position, the patient will recognize, hey, it was just borderline 92, but they're lying down prone, it's becoming 96. Very, very good, very well taken. So you must give this simple advice for sure. So lastly, it's the COVID-19 virus, which is saying, beat me if we can. And we're saying, yes, we will and we can, because the vaccination drive is around the corner. Again, we want all our volunteers to gear up and help us in the mass vaccination drive. We are trying to get the procurement on a bulk basis, and we will soon be sharing with you when that's going to be available. But when it is available, let's do our best to get the jab into everybody who is eligible and who deserves it. So this is the first phase. 14 crore people have been vaccinated, which means the minimum supply that we will need is another 14 crore for the second jab that these have to get. And really, the production is not matching the demand. Lastly, I close with this slide. The next generation, please help us that they look back and thank us for joining hands with BNP, with the volunteers, with the hospitality industry, as in the hotels and the supplies which are coming to our rescue in the step down system, the yellow and the green zone, and of course the healthcare providers who are the warriors ever ready to fight this. And this crown somehow seems to depict the very pattern of the COVID-19 virus. So I have chosen this picture, and there is a lot that is happening and a lot that needs to be known. But the point is that it is not a rocket science. Most of you, if you apply your mind a little bit, pay attention to details when you're conversing as a volunteer with whomsoever you're conversing. Please don't escalate their panic by you yourself getting more panicky. Just guide them to specifically tell about other members at home as well, because you would be expanding the own scope of your voluntary help to the rest of them in a very proactive manner. So I do hope on my second appearance, I've made some more things clear to many of the friends and volunteers and viewers here. We are always available at your service, but there is only a little that each of us can do. So we are gathering a group together to escalate our efforts, to enhance our efforts, to make it more meaningful and to make it more scalable to reach as many as possible. And the intent of Shrikantji, Monica, Nisha, Soumya, Jyotsna, Shetty, Prasanna, and everybody whom we have talked to in the last few days, we have really been impressed by their very strong motivation and intent that even if we can do little, we will look back with satisfaction that we have done our bit in this great challenge that the whole world is facing. Namaskar. Thank you very much. And Monica, over to you to raise the questions. So if you pass the questions out, I will be happy to answer them.
Yeah. Thank you so much, Dr. Hema. That was immensely useful. Lots of questions, actually. So what I'll do is, just some questions were asked yesterday as well as today. So I'll just mention them to you. One important question, and we'll have to go really quickly, request to all the participants who we unmute to just keep the questions brief as well, because there are many questions. So one question many are asking Dr. Hema is that what is the maximum gap between two vaccine doses? So because vaccines are not available now, so for the second dose, what is the maximum they can go with?
Okay, I will give you a true answer that we don't know actually what should be the gap, but the guess is that 4 to 6 weeks should be the ideal gap. Even as late as 8 to 10 weeks is okay. And it looks like because there is a dearth for vaccine supplies, it will by default be 8 to 10 weeks, but which is okay. And even one jab, even those who have had the first dose are definitely more protected and less infective than those who have not got vaccinated. So those who are above 60 and missed the bus, those who are above 45 and missed the bus in the first circuit, really, it's a missed opportunity, but the next round of supplies, slowly, steadily, they are coming in. But let vaccine hesitancy not come in the way. 4 weeks is earliest, 6 to 8 weeks is generally.
Okay. So both for Covaxin and COVID Shield.
Yes, both, because the whole world is just doing it by guesswork. The second dose is called the booster dose. It is to recall the memory of your immune system. Hey, you get geared up in case this virus and the mutants come. Be ready to fight. That's what the vaccines are telling them.
Okay, great. And some are asking if they can. Who do they call to have vaccination drives in their apartments? Is there a number that we can share with them?
No, actually, as per our information, we are in conversation both with the government and the manufacturers, because we need at least about 5 lakh doses per month. So we placed order for 2 million doses in 3 cities in the country, but we are unlikely to get it in the next 3 weeks. 3 weeks is the earliest that they have promised, but we have to hold on. That's why I was saying, Srikanji, let's put our implementation plan in place, because many small hospitals which are non-COVID hospitals should develop as a vaccine centers, because people confidently can step into those centers, finish their vaccine quickly and go home, and they're non-COVID, so their minds are also a little comfortable. But slowly, after this crystallizes, we'll start going to the apartments, colleges when they open up, and maybe other common places where we should not gather too many people. That's also, an issue. But there is a lot of scope to organize ourselves and make this drive a reality.
Okay, great. Thank you. The other, a lot of them are asking if they can have access the presentation that you just shared to look at the charts.
I will put it on the group.
Yeah, yes, that's I will just unmute Gopal Krishna. He has raised his hand long back. Okay. Gopal Krishna, you can ask your question, please.
Hello, doctor. Good morning.
ನಮಸ್ಕಾರ.
ನಮಸ್ಕಾರ ಮೇಡಮ್, ಇವಾಗ ಆಸ್ತಮಾ ಪೇಷಂಟ್ಸ್ ಇರ್ತಾರೆ, ಅವ್ರಿಗೂ ವ್ಯಾಕ್ಸಿನೇಷನ್ ತಗೋಬಹುದಾ?
ಖಂಡಿತ, ಅವ್ರಿಗೆ ತಗೊಂಡ್ರೆ ಅವ್ರಿಗೆ ತುಂಬಾ ಅನುಕೂಲ ಆಗತ್ತೆ. ಯಾಕಂದ್ರೆ ಅವ್ರ ಲಂಗ್ಸ್ ಅಷ್ಟಕ್ಕಷ್ಟೇ ಕೆಲಸ ಮಾಡ್ತಾ ಇರತ್ತಲ್ವಾ, ಅದಕ್ಕೆ ಇದು ತುಂಬಾ ಪ್ರೊಟೆಕ್ಷನ್ ಅವ್ರಿಗೆ ಕೊಡತ್ತೆ. ಖಂಡಿತ ತಗೊಳ್ಬೇಕು. ಆಸ್ತಮಾ ಇದ್ದವರು, ಡಯಾಬಿಟಿಸ್ ಇದ್ದವರು, ಹೈಪರ್ಟೆನ್ಸಿವ್ ಡಿಸಾರ್ಡರ್ಸ್, ಕಾರ್ಡಿಯಕ್ ಡಿಸಾರ್ಡರ್, ಅವರಂತೂ ತಗೊಳ್ಳೇಬೇಕು. ಯಾಕಂದ್ರೆ ಅದೆಲ್ಲ ರಿಸ್ಕ್ ಫ್ಯಾಕ್ಟರ್ಸ್ಗೆ ಆಡ್ ಆಗತ್ತೆ. ಸೊ ಅವ್ರಿಗೆ ತಗೊಂಡ್ರೆ ಮಿಕ್ಕಿದವ್ರಿಗಿಂತ ಅವ್ರಿಗೆ ಅನುಕೂಲ ಹಾಗೂ ಲಾಭ ಜಾಸ್ತಿ ಆಗತ್ತೆ.
ಬಟ್ ಆದ್ರೆ ಈ ಟೈಮಲ್ಲಿ ಅಕಸ್ಮಾತ್ ಏನಾದ್ರು ಅವ್ರಿಗೆ ಏನಾದ್ರು ಸ್ವಲ್ಪ ಸಿವಿಯಾರಿಟಿ ಆಗ್ಬಿಟ್ರೆ ಇದು ಸಿಗಲ್ವಲ್ಲ ಮೇಡಮ್, ಬೆಡ್ಸ್ ಇದೆಲ್ಲ ಸಿಗೋ ಕಷ್ಟ ಇರುವಾಗ ಈ ಟೈಮಲ್ಲಿ ತಗೊಳ್ಳೋದು ವಾಸಿನಾ?
ಹಾಗಲ್ಲ, ಇವಾಗ ಸಿಕ್ಕಿದ ತಕ್ಷಣ ನೀವು ಕೋವಿನ್ ಆಪ್ ಅಲ್ಲಿ ರಿಜಿಸ್ಟರ್ ಮಾಡ್ಬೇಕು. ತುಂಬಾ ಕ್ಯೂ ಇದೆ. ಅದಕ್ಕೆ ನಿಮ್ಗೆ ಇವಾಗ ಆ ಬೆಡ್ ಸಿಚುವೇಶನ್ ಎಲ್ಲ ಈಸ್ ಆಗೋ ಅಷ್ಟೊತ್ತಿಗೆ ನಿಮ್ ಕೈಯಲ್ಲಿ ನಿಮ್ಗಾಗೋ ಅನುಕೂಲ ಆಗೋ ತರ ಡೋಸ್ ಸಿಗತ್ತೆ. ಅದಕ್ಕೆ ಇವಾಗ ಈ ತರ ಇದೆಯಲ್ಲ, ನಾನು ಆಮೇಲೆ ವ್ಯಾಕ್ಸಿನ್ ತಗೊಳ್ತೀನಿ ಅಂತ ನೀವು ರಿಜಿಸ್ಟರ್ ಮಾಡದೇ ಇದ್ರೆ you will miss your position in the queue. ಯಾಕಂದ್ರೆ ಸುಮಾರು ಒಂದು 4 ಲಕ್ಷ ಜನ ಆಲ್ರೆಡಿ ವ್ಯಾಕ್ಸಿನ್ಗೆ ನಿಂತಿದ್ದಾರೆ. ಆದ್ರೆ ನಮ್ಮ ಹತ್ರ 1 ಲಕ್ಷ ವ್ಯಾಕ್ಸಿನ್ ಕೂಡ ಇವತ್ತಿಗೆ ಸಪ್ಲೈ ಇಲ್ಲ. ಅಷ್ಟು ಗ್ಯಾಪ್ ಇದೆ, ಅದರಲ್ಲಿ ಅಷ್ಟೊಂದು ಗ್ಯಾಪ್ ಇದೆ. ಅದರಿಂದ ಅದು ಗವರ್ಮೆಂಟ್ ಮೂಲಕನೇ ಇವಾಗ ತರಿಸ್ತಾ ಇದ್ದಾರೆ. ಆದ್ರೆ ಪ್ರೈವೇಟ್ ಪ್ಲೇಯರ್ಸ್ ಕೂಡ ವ್ಯಾಕ್ಸಿನ್ ಮ್ಯಾನುಫ್ಯಾಕ್ಚರರ್ಸ್ ಹತ್ರ ಡೈರೆಕ್ಟ್ ಆಗಿ ಸಪ್ಲೈಗೆ ಕೇಳಿದ್ದೇವೆ. ಆದ್ರೆ ಫಸ್ಟ್ ಅವ್ರಿಗೆ ಗವರ್ಮೆಂಟ್ಗೆ ಕೊಟ್ಬಿಟ್ಟೆ ಆಮೇಲೆ ನಮ್ಗೆ ಕೊಡೋದು. ಅದಕ್ಕೆ ಇದಕ್ಕೆ ಖಂಡಿತ ಟೈಮ್ ಆಗತ್ತೆ ಅನ್ನೋದು ಮಾತ್ರ ನೀವು ಬರೆದಿಟ್ಕೊಂಡ್ಬಿಡಿ ಗೋಪಾಲ್ ಕೃಷ್ಣ. ಅದಕ್ಕೆ ನೀವು ಕ್ಯೂನಲ್ಲಿ ಯಾರೇ ನಿಮ್ದು ಪೇಷಂಟ್ ಇರ್ಲಿ, ಮನೆಯವ್ರಿರ್ಲಿ, ಕ್ಯೂನಲ್ಲಿ ನಿಲ್ಸ್ಬಿಡಿ ಅವ್ರನ್ನ.
ಓಕೆ, ಶ್ರೀನಿವಾಸ್, I think you had a question. Okay, I think he's muted.
I think it is Madam Pushpa Srinivas.
Oh, is it?
The better half of Dr. Srinivas.
Okay. Okay, someone from Rotary Bangalore, RT Nagar is, I'll just...
Yes.
Good morning, doctor. Thanks for...
Yeah, sorry, go ahead.
Can you hear me?
Yes.
Yeah, okay. My name is Satyanarayanan. I took my first jab on 3rd of April, but I was tested positive as on 1st of May. Everything is fine. I'm recovering well, and I completed a medication under guidance of my doctor. Now, my wife was with me for almost 36 hours when I was tested positive. Though she moved out, we did not want to take a chance, so we took the second RT-PCR and confirmed us positive. She had her both the vaccinations. Second one was taken on 23rd of sorry, my apologies, 26th of April, the second one, and now she is positive. Though her SPO CO2 as well as temperature is all under control. We are doing pranayama, breathing exercise very religiously
Excellent.
and very positive. Being diabetic, there is a little bit of a worry. So if you can just guide us, doctor.
Yeah, that's what, right? This luckily, because the vaccination jab, even that one jab is protective, as I told you, and she's already finished her 2 doses. So the course of the disease itself, you yourself said that oxygenation and the temperature being normal, the infective status remains for about 28 to 30 days. So till then, to recover from the fatigue, from the the basic, some meager symptoms that you're not feeling all that okay, and that will be there, but that is not of a serious concern because it is not going to drive you any further downhill. So far so good. Please continue to hydrate yourself. The pranayama etc. should continue, but another 2 weeks to wait before, and then also the masking, the hand washing, social distancing is a must even for the vaccinated. Even she comes back home, then the same precautions need to be taken for at least another 2 weeks to 3 weeks. Yeah. But then you're well on the green, so the worst is over. I can't recall the name. Rotary Satyanarayana Atinagar. Yeah.
Yeah, I think.
Yeah, the worst is over. So I think you're on the other side of the fence now.
Thank you so much, doctor. Thank you so much.
Great. Saroj, I think you had a question. Saroj?
Saroj has to unmute. Saroj Sinha.
I think, yeah, she has to.
Okay, I unmuted.
Yeah.
Ma'am, I was just asking, my mother got positive. She is, I think, 68. Okay.
Yeah.
And, but she has not taken vaccination. Can she take vaccine?
It is from the date that she was recorded positive, at least we have to wait for 8 to 9 weeks before she can take the jab. So in any case, I said, all these problems will ease out because there are no vaccines now available. So she has to wait for a while. Just check with your doctor again, because if she's just recently tested positive, then about 9 weeks gap has to be given before she takes the vaccination.
And one more thing, ma'am, everyone is telling, I am listening like that. If somebody is taking co-shield in first time, they have to take co-vaccine in other time, because both will give different effect. Is that?
No. The dictum is that it is said that Covaxin will cover the mutants and the larger family of COVID-19. Okay. But the one who has taken one make, if the second time also they take the same, it's fine. Second time that is not available because some people from Hyderabad, for example, have moved into Bangalore, and Bangalore is only giving Covishield. It's okay if they take Covishield also. It is on the principle. The vaccines, please remember everybody, it is on the principle of something better than nothing. That is what is the status of vaccination is now, because 70 to 80% protection is also considered as a very good protection, because you will not go into the red zone. And as long as you don't go into the red, you can win the game.
One more news is coming, no, ma'am, that sanitize something, that nasal spray. Is that is also good?
No, the steroid nasal spray is strictly as per the doctor's advice, because that has to be given in that window period of the cytokine storm, which I mentioned. So that has to be a doctor's discretion, and please do not start using the wrong things at the wrong time. The whole key for the management of COVID is the right medication in the right doses at the right time. And that is a mix and match for every individual patient. Therefore, it needs a specialist doctor's. See, like if I'm a routine OB/GYN, not interested in COVID, I cannot even treat that, because I need that special know-how and training of the latest protocols, which are changing by the minute, believe me. So if sometimes they said this is good, then they revise saying this is not so good, then they said this should never be given. All those mix and matches happening in the scientific world as well. So please don't go ahead, except hydration, paracetamols, and the exercises. That is entirely, you are licensed for this, but not more than that. Because if you can't get in touch with your doctor and you're spiking high fever, absolutely it will be advisable to take a paracetamol and get that fever down. That is really crucial. But beyond this, you need the advice of the doctor, because you should not give the steroids nebulizer at the wrong time.
Yeah. Thank you, doctor. And in fact, to all the attendees as well, there are many questions that different people may have. You can talk to your doctor or reach out to BNP. BNP has a doctor panel and they'll connect you to a doctor panel if you need advice. Dr. Hema, how much time do you have? Because there are lots of questions coming.
No, today I have time, unlike yesterday where I was hard pressed for time.
Okay.
I will be happy to take some more questions.
Okay. I think let Imran, if you could unmute yourself and.
Yeah. Hello, doctor. Thanks for the session. Doctor, I just wanted to know with regard to the kits, basically, is it the same protocol or there is a variation? Means ಏನಾಗೋದಂದ್ರೆ ಮನೆಯಲ್ಲಿ ಮಕ್ಕಳಿಗೆ ಇವಾಗ ಜ್ವರ ಬಂದ್ರೆ so we get 10 days. What exactly is to be followed? ಅವ್ರಿಗೂ it is the same. We need to check with the oximeter and the same levels, or there is a difference ಅಂತ.
ಅವರೇ ಸಿಂಪ್ಟಮ್ ಇದ್ದವ್ರಿಗೆ ಮಾತ್ರ ಡಾಕ್ಟರ್ಸ್ ಹತ್ರ ಕನೆಕ್ಟ್ ಆಗ್ಲೇಬೇಕು ಇಮ್ರಾನ್. ಡಾಕ್ಟರ್ಸ್ ಹತ್ರ ಕನೆಕ್ಟ್ ಆಗ್ಲೇಬೇಕು. ಯಾಕಂದ್ರೆ ಜ್ವರಕ್ಕೆ ನಾನಾ ತರದ ಕಾರಣ ಇರುತ್ತೆ. ನೀವು ಬರೀ ಆಕ್ಸಿಮೀಟರ್ ಅಲ್ಲಿ ನೋಡ್ಕೊಂಡು ಅದು ಚೆನ್ನಾಗಿದೆ ಅಂತ ಅನ್ಕೊಂಡು ಅದು ಜ್ವರ ಬೇರೆನೆ ಏನಾದ್ರು ಡೆಂಗ್ಯೂನು ಇರ್ಬೋದು, ಇನ್ನೇನಾದ್ರೂ ಇರ್ಬೋದು, ಅದು ಲಂಗ್ಸ್ ಗೆ ಎಫೆಕ್ಟ್ ಮಾಡದೆ ಇರ್ಬೋದು, ಇನ್ಯಾವುದೋ ಸಿಸ್ಟಮ್ಗೆ ಎಫೆಕ್ಟ್ ಮಾಡ್ಬೋದು. ತುಂಬಾ ಅದು ಹಂಗೆ ನೆಗ್ಲೆಕ್ಟ್ ಮಾಡೋದು ತುಂಬಾ ರಿಸ್ಕಿ ಆಗತ್ತೆ. ಯಾಕಂದ್ರೆ the whole world is not affected only with COVID. There are other non-COVID diseases also which give rise to fever. Even things like malaria fever, if you don't treat it correctly, ಅದು ಪ್ರಾಬ್ಲಮೇ ಆಗಿ ಕೂತ್ಕೊಳ್ಳುತ್ತೆ. ಅದಕ್ಕೆ ಮೋಸ್ಟ್ಲಿ ಮಕ್ಕಳಿಗೆ ರೆಸ್ಪಿರೇಟರಿ ಇನ್ಫೆಕ್ಷನ್ ನಮ್ಮ ದೇಶದಲ್ಲಂತೂ ಎಲ್ಲ ಬರ್ತಾನೆ ಇರತ್ತೆ. ಬಟ್ ಅದನ್ನ ನೀವು ಡಾಕ್ಟರ್ ಹತ್ರ ಕೇಳಿ, ಅದು ಪ್ಯಾರಾಸಿಟಮಾಲ್ ಸಿರಪ್ ಕೊಡೋದ್ರಲ್ಲಿ ತಪ್ಪೇನಿಲ್ಲ. ಜ್ವರ ಇಳಿಯತ್ತೆ. ಜ್ವರ ಯಾವ ಕಾರಣದಿಂದ ಬಂದಿದೆ, ಇದು ಕೋವಿಡ್ ಅಂತ ನಮ್ ತಲೆನಲ್ಲಿ ಕುತ್ಕೊಂಡ್ ಬಿಟ್ಟಿರೋದ್ರಿಂದ ಮಗುಗೆ ಕೋವಿಡ್ ಇಂದಾನೇ ಜ್ವರ ಬಂದಿದೆ ಅಂತ ನಾವು ಹೇಳಕ್ ಆಗಲ್ಲ ಅಲ್ವಾ. ಸೊ then the specialist will decide what are the tests has to be done. Maybe it's a fever due to some other cause, how it has to be treated. Suspicion of course will be very very high, because what is the most common thing happening around us, ಅದನ್ನೇ ನಾವು ಫಸ್ಟ್ ನಮ್ ದೃಷ್ಟಿನಲ್ಲಿ ಇಟ್ಕೊಳ್ತೀವಿ. ಒಂದು ಸೀಸನ್ ಅಂತ ಇರತ್ತಲ್ಲ, ದಿಸ್ ಇಸ್ ದ ಕೋವಿಡ್ ಸೀಸನ್, ದಟ್ ಇಸ್ ಹೈ ಆನ್ ದ ಲಿಸ್ಟ್. ಬಟ್ ಬೇರೆ ಕಾರಣಗಳು ಎಲ್ಲ ಓಡೋಗಲ್ವಲ್ಲ. ಕೋವಿಡ್ ಬಂದಿರೋದ್ರಿಂದ ಬೇರೆ ಇಲ್ಲ ಅಂತ ಹೆಂಗ್ ಹೇಳ್ತೀರಾ? ಸೊ ವಿ ನೀಡ್ ಚಿಲ್ಡ್ರನ್ಗೆ ಇನ್ನ ಸ್ವಲ್ಪ ಇದು ಕೇರ್ ತಗೊಳ್ಳೋದೇ ಉತ್ತಮ. ಯಾರು ಎಲ್ಲ ಏನಾಗ್ತಾ ಇದೆ ಅಂದ್ರೆ, ನಮ್ಗೆ ಕೋವಿಡ್ ಬಂದ್ಬಿಟ್ರೆ ಕಷ್ಟ, ಟೆಸ್ಟ್ ಮಾಡಿದ್ರೆ ಎಲ್ಲಿ ಪಾಸಿಟಿವ್ ಬಂದ್ಬಿಡತ್ತೋ ಅಂತ ಹೆದರ್ಕೊಂಡು 4 ದಿವಸ 6 ದಿವಸ ಲೇಟ್ ಮಾಡ್ಕೋತಾ ಇದಾರಲ್ಲ, ಅವರು ತುಂಬಾ ತೊಂದರೆಗೆ ಸಿಕ್ಕಾಕೋತಾ ಇದ್ದಾರೆ. ಯಾಕಂದ್ರೆ ದ ರಶ್ ಫಾರ್ ದ RT-PCR ಇಸ್ ಹ್ಯೂಜ್. ನಮ್ಗೆ 1 ದಿವಸದಲ್ಲಿ ರಿಪೋರ್ಟ್ ಸಿಗ್ತಾ ಇತ್ತು ಮುಂಚೆ, ಈಗ ನಾವೇ 5 ದಿವಸ ವೇಟ್ ಮಾಡ್ಬೇಕಾಗ್ತಾ ಇದೆ ಇಫ್ ಯು ಸೆಂಡ್ ಇಟ್ ಟು ಅ ಸೆಂಟ್ರಲೈಸ್ಡ್ ಲ್ಯಾಬ್. ಯಾಕಂದ್ರೆ ಎಲ್ಲಾ ಕಡೆಯಿಂದ ಅವ್ರಿಗೆ ಅಷ್ಟು ಲಕ್ಷಾಂತರ ಟೆಸ್ಟ್ಗಳು ಬಂದು ಕೂತ್ಕೋತಾ ಇದೆ. ಸೊ ಯು ರಿಯಲಿ ನೀಡ್ ಟು ವರ್ಕ್ ಯೋರ್ ವೇ ಅರ್ಲಿ ಅಂತಾನೆ ನಾನು ಹೇಳಕ್ಕೆ ಇಷ್ಟ.
Thank you, Dr. Hema. I will just Jyotsna asked you. Okay, she's not there. Ashwika.
Jyotishri, I think.
Oh, Jyotishri. Yeah, Jyotishri, are you there?
Yes. Am I audible?
Yes.
Yes.
Okay. Hi, doctor. Very informative session, ma'am. Thank you. Ma'am, I have, this is my case. I had symptoms like cough and I lost taste and smell, but my RT-PCR report was negative. So when I showed to my doctor, he continued the same general medicines like Calpol, Doxy and all, and I took that for a couple of more days. So I'm fine now. I also took home medications, but I have doubt that what is the probability that I will get infected again? That's my first question. And second question is about the vaccination. When am I eligible to take vaccination? Because as per the guidelines, if a person is infected, we are not supposed to take vaccination immediately, right?
Yes, yes.
Yeah.
That was a question that somebody else raised also. 8 to 9 weeks gap you must give. So Jyoti, you are in the 30% group of false negative RT-PCR. So RT-PCR came negative, but the loss of smell, what you have said, that's a very key symptom. So nowadays what we are looking at as doctors is, if any of the symptoms which are very classic for the COVID-19. See, fever can be, as I've just explained to Imran, they can be, or Saroj, they can be due to other reasons. But loss of smell, etc., suddenly happening to young adult, it is a strange thing, and COVID-19 is the most likely cause. So even if your RT-PCR is negative, that's why the doctor has put you on doxy and other drugs, which are typically the treatment for COVID-19 infection. So you're right in presuming that you were infected, you had some symptoms, but your test came negative, but now you're well, so you've recovered. So 8 to 9 weeks, as I said, has to be the gap before you take the vaccine. You cannot bombard your system to fight out again when you're just convalescing or recovering. So 2 months is the time frame that you must allow yourself.
Thank you.
Okay,
Thank you,
what is the
doctor.
probability that I get infected, doctor? Okay.
Again, if you really take your vitamin D, zinc, hydrate yourself, mask yourself, wash your hands, and social distancing, that is the key. And all these simple things which I told about the maids and the touch points where you may not have paid attention to, and it may be around you. That much preventionary precautions you take, then reinfection is really remote. But if you do have symptoms again, or if you don't have symptoms but you you have a strange doubt, then all that you've got to do is your oxygenation monitoring with the pulse oximeter. So the reinfection for a young patient without any diabetes, hypertension, etc., fully recovered, it's unlikely. But if you don't take precautions, then it is it's not easy to escape this virus.
Okay, thank you, doctor. Ashvika? Okay, I think you're on. Ashvika? Okay, I think we'll move to Malini then. Malini, will you unmute yourself and?
Yes.
Yeah.
Thank you, Dr. Hema. It was a very informative session. I have two questions. One is this.
Sorry.
Malini is muted again. Malini, just unmute
Malini,
and
can you
talk.
just please unmute yourself?
Sorry.
Yes.
So, Doctor, I thank you for the very informative session. I wanted to know when the CRP, ILX, D-dimer test, I mean, is the patient supposed to do it, or when they get admitted, it is done for them? That's one thing. And if the patient has to do it, when do they have to do it? And second is, if a person is asymptomatic, but is infected, he will not even know that he's infected. In such a situation, can he? What happens if he goes and takes a vaccine?
That is, if it's asymptomatic and not tested, okay, and if he has a contact who is somebody living in his own home or the apartment, if they are infected, then even presuming that no symptoms are there, it's better to get the contact tracing in that bracket. It's better to get the test done, because when it's positive, then you have to avoid the vaccination. You can also do a rapid antigen test, and if so that's another way of checking. So if rapid antigen test will also give you a clue whether you can go ahead with the vaccination or not. And the other question, Malini, just tell me that.
The CRP.
CRP, okay.
Okay.
So usually why I explained about all that is some of the volunteers may get the call where the patient will start telling this, that, and the other, and it makes no head nor tail. So who has asked for the test also, we don't know. So we have to refer to the group of doctors that we have, and they will interpret it. But usually the doctors will ask for these tests, because if the RT-PCR is not done, okay, but the symptoms are there which are suggestive, then instead of doing a CT, which is very dangerous in the view of the fact that you may pick up more viral load from the same CT machine being used for so many infected patients, they will ask for these simple set of blood tests. Okay, so in that, yes, there is the CRP, there is the IL-6, there is the D-dimer, there is another simple thing called complete blood count, CBC. In that, they will see the ratio of N and L, neutrophils and lymphocytes. Such a simple, like a KG class student, if the doctor reads that also, he will know which way we are moving. And based on that, based on these parameters, the doctor will be able to institute the treatment early along the lines of presumed COVID-19 infection. And that is a big plus. That is where it stands.
Okay. Thank you very much, Doctor.
Thank you, Malini. Jyotsna, if you can just.
Ashwika is, I think, unmuted now. Ashwika?
Ashwika is unmuted, is it? Okay. Yeah, Ashwika? No. Ashwika, I think there's a problem with, okay. Ashwika, if you just sort out your microphone, by that time, Jyotsna, I think, can just ask. Jyotsna?
Yes, hello, doctor. Thank you so much for such an informative session today. So just a personal question, since all of our family members are working from home for past 1 year, and there has been absolutely no outside contact, like not even maids are coming in, should asymptomatic people like us should also go through any test, especially like for my mother-in-law, her oxygen level has been stable at 95. So what do you suggest, ma'am?
No, see, all the healthy people cannot be as a blanket considered as asymptomatic but likely to have COVID positive. That's not the way we look at it. You will definitely test if there are symptoms, and if you have a contact with, many are staying in the apartments. The next door apartment person is having positive, then it's better that you get tested if you're just, next door, not in the next building. And also the maid is coming from 5-6 houses, and then she reports that somebody in some house has tested positive, so they have asked her not to come for 2 weeks. If that's the kind of information your maid gives, then your maid is your contact. She has gone to that house, some person is tested positive, and today she has come to your house also.
No, ma'am, there have been no such maids for last 1 year. We have been doing ourselves.
Yeah,
but yeah, like home deliveries and all we take and do sanitize regularly.
Then there is really no need for anybody and everybody rushing for testing, because it doesn't come in any kind of eligibility bracket for testing, because otherwise all the 1.3 billion people will have to test. No,
yeah. Thank you, ma'am. So just being at a safer side. Thank you so much.
Yes, yes. But Jyotsna, congratulations to you for your commitment, and I can really palpate the way you feel for the patients that you're handling. So my hats off to you. And
all learning from seniors like you, ma'am. Thank you so much, and thanks goes to all the dedicated volunteers of BNP.
Thank you.
Thank you,
Jyotsna.
Thank you, ma'am.
Yeah. Can you hear me, ma'am?
Yeah,
now?
Ashwika.
Yeah. No, this is Ashwika's father, Ashok. I couldn't rename it. My daughter's device. Sorry. Yeah. Thank you so much for the informative session. I could able to connect the dots, and it is so helpful in helping patients in guiding and all. Thank you so much. One question. So Tamil Nadu government, so they are suggesting Ayurvedic medicine, some Kabasur Kudineer. And yesterday I could see there is a government which has released a letter to encourage Ayush 64 and Kabasura Kudineer. So is there any harm for patients who are taking allopathic medicine to take this Ayurvedic as well?
Allopathic medicines for COVID, if they're taking
COVID, yes.
Then maybe if they're selling it as Ayush immunity booster, etc., which may not have a great evidence, but it is not going to clash with the allopathic system. But the true answer is, I'm sure that the time will tell whether those will come to stay or not. The government may have, because there's also something called a faith healing. So it is like the patient is thinking that they're taking something, so it is boosting. So that morale, that positive set of mind will definitely improve the immunity. That theory is there. So maybe indirectly it is helping in that we cannot discard anything just because we don't know what it is. But I'm quite sure that if all the parameters are improving with the known medication that the person is taking, then they are well on their path to recovery. Just like the zinc and vitamin D, which has hopped in the front line, that it will boost immunity. We always knew that, but nobody was actually taking it on a regular basis because everybody thought they will handle things by themselves. Now they're taking this supplement. Like that, maybe this is also one of the supplements which will handhold the immune system.
Got you, ma'am. So the answer is like, so they can use it, means because it will not clash with this thing. Yeah, got you, ma'am. Thank you so much.
But they should use it with the firm belief in their mind that they don't know whether that is really helping or not. If they think, oh, that I have got great immunity, I can go out without a mask, then no.
No, yeah, understood. Yeah. Thank you.
Thank you. Thank you. Romel, if you unmute yourself, please.
Hey, hi. Thanks, Monica. Thank you, doctor. That session was really, really helpful. I had largely most of my questions were answered, but I still have three. One is there a daily regime that you can suggest that everyone follows just to be on the protective side of things? I think Josna briefly touched upon that, but I just wanted to understand, is there a daily regime that, we as individuals who think I'm not affected, I've not been in touch, I've taken all the care, that we can, this is just to detect the early signs. That's one. Number two is when you say it's airborne, what does it that it exactly mean for a layman? And my third and last question is more on preparation, and fingers crossed it never comes. There are talks on the WhatsApp groups about the third wave being intensive on children. I just wanted to understand whether that's something that's a reality or just a WhatsApp university product. Those are my three questions.
Yeah, it's easy to start with your third question. So let me tackle that first. COVID-19 and its mutants are really fooling all of us because we don't know what's going to change and how it's going to change. There's a huge difference in the conduct of the COVID-19 mutants. First wave is quite different, has been quite different from the second wave. All lessons that we learned from first wave are useless for the second wave. That is the scenario as on today. The prediction, the mathematical models that they do, they sit on the computers and do some programming and say that because of this, we expect this thing to happen. That is like an astrological prediction they're doing. But the COVID-19 virus is not sticking to any norms or rules. It does whatever it wants. So the predictability model, which they're saying, now the second wave has affected lesser age group. That is like 30, 35, 40, 45, even without comorbidities are losing their lives. So the modeling, the way it is going, they're saying that the third wave may affect again another younger age group. It's from elderly, it came to the midsection to the children. That is the thought process which is going on in the scientific world, but you never know that COVID may just fool us and it may not really come to the children, or it may come to everybody at one go. So being guarded, being cautious, that comes to your first question, which is the norm. Another couple of months, we are not going to escape. We are only thinking that because of the lockdown, we are following the rules. That is not going to get us anywhere. Lockdown or no lockdown, whether you're here or there, we have to do the distancing and the mask. That is inevitable, though it's such a pain. But that has to stay. The precautions that you need to take is what we've been telling for the last whole year, right from the first wave, that don't stop the social distancing. Simply little one function, one birthday, my child's this and that, let's do it. For a long time we haven't met people. Please cut out all those temptation, because crowd will really trigger off. You don't know from where it's coming and when it's coming. So that has to be, social events have to be strictly avoided. Then the parcels coming to your house, so just let them leave it at the door and then you just take it. So face to face, you must not meet that person. Please make sure that your maid, however uncomfortable she is, or the cook, she will wear the mask. And you also, if anybody at home is infected, then you have to maintain a distance. But even otherwise, generally maintaining a distance, like while watching television, people can sit down at that distance, because you never know which member has gone out for what and come. Maybe he's just gone to the next door medical store and come. And so you just need to play safe on all of that. Just be guarded till we know more about this. And the mid question which you asked about airborne, what it means. Initially, they said that it is not airborne because the particles of the COVID-19 virus were heavy. So they said when somebody talks loudly or spits or coughs, okay, the virus will go and it will drop down on the floor within a short distance of 2 feet. So if you're standing at 3 feet, the virus is coming out of my mouth, but it is stopping short in 2 feet and falling on the ground. So if you are at a 3 feet distance, it will not run from 3 feet distance. It will not run and it will not infect you or affect you. Okay, that is the whole purpose of it, is double masking also, which nowadays we are recommending. But now the recent things is the way it is spreading like wildfire. You are maintaining distance, but still it is coming. Somebody is at home, presuming that they're taking the best of the care, still it's coming. So that means it is in the air. It is, the mutants are lighter particles which are not falling down at 2 feet, which are just generally, that is why they always say open the windows and or even when you are self-isolating, because cross ventilation should be there. Air which is infected should move out and the fresh air should come in, etc., etc. So you double mask, but you can stand at the window where the window or the balcony needs to be. I mean, you can breathe some air, but through your mask. So airborne means that anybody potentially at any distance is likely to get cross-infected from one and another. That heavy particle size of the COVID is not existent in the mutant form. That is why we really, really don't know the answer to the question what the future holds.
All right.
Great. Sri Devi, I think we'll just take the last 2-3 questions and close at 11. Is that okay, Dr. Hema?
Yeah.
Yeah. Okay. Yeah.
Madam, can feeding mothers take vaccination? Because my house help's daughter-in-law is a feeding mother. The baby is only 4-5 months old. So when she gets her turn, can she take the vaccination?
Actually, the government recommendation as yet is that vaccine should not be given to pregnancy and lactating mothers. Even yesterday, they released a very strong and a strict guideline that we don't have Indian data on the pregnant and lactating mothers. So professionals are being told by the government guidelines and dictate, if you may say, that we should not give it to pregnant and lactating mothers, though all the other organizations in the world and the world bodies have recommended that yes, you can give. If you're in Israel or if you're in UK or if you're in US, they are giving to the pregnant and lactating mothers because the mother has to be protected primarily. That is the intent. It's a matter of her human right that she cannot get sick and lose her life just because she's lactating and she's been denied of the vaccine. That is their thought process. But I guess our government will, maybe in another 6 months, they will release the guideline, because if they say for pregnant and lactating mothers, Sri Devi, there are 30 million pregnant women every year in our country, and an equal number, therefore, of lactating women. So we will need 60 million doses extra, which we don't have now. So they are a bit hesitant to release the guideline as of now. That is the truth of the matter. So, but if she has crossed 6 months of exclusive breastfeeding, maybe in another 2 months' time, she will get over that, phase of exclusive breastfeeding. The child is on breastfeeding, but all the other. Then she's not, into quotes, considered as a lactating mother. She's finished her pregnancy. She's finished her exclusive feeding phase. Now she becomes eligible as any other general citizen to get the jab, and then, yeah, we can give it to her.
Okay, great. Thanks. Last question, Doctor. Kiran. Kiran, if you just unmute and.
Yeah. Thank you, Doctor.
Hi, Kiran.
Hi. My sister-in-law actually came down with COVID and she became critically ill. She got admitted to the ICU and was on ventilator. So when she was in the ventilator, I actually visited her in the ICU with all the PPE kit, double masking, face shield, and all the required measures. So 4 days I visited her. And now actually it is, I visited last on 30th April. So it's nearly 10 days, 8 days since I visited the ICU. But I'm a little apprehensive because I stay with my aged in-laws, and my husband is diabetic. So I sort of in quarantine. I can't say it is 100%, but I'm trying to stay away from them. I'm masking when I'm going out. I mask up and go out. So, and also I've taken my first dose, and I'm due for the second one. 6 weeks since I've taken my first dose. So I just.
So 2 quick questions, Kiran, to you. Your age and if you can reveal your age and your status of diabetes, hypertension, etc.
No, I don't have any comorbidities. I am 46.
Yeah. So whatever you're doing now is very appropriate, and you must continue that. And I'm happy that you've taken the first. And whenever you're on the COVID list and you're eligible for the second jab, please go ahead and have that as well. And if you have any symptoms whatsoever, you run fever, if you have loss of smell and taste, and if you have cough, and if you have giddiness or drowsiness, any small suspicion of any single symptom, then you have to please go for the RT-PCR test.
Okay.
But looks like you and you are unlikely to have that also, because luckily you've taken the first jab, which is really, believe me, 70-80% protective already, and you've been sensible enough to carry to continue the precautions in the manner that you've just explained, which is excellent, brilliant.
Sorry.
There was again another question about nebulization at home.
I think
that has to be under doctor supervision, because that steroids at a wrong time can cause more harm than use. Okay, there's also somebody who has written that oxygen cylinders in the school buses we can carry here and there. But again, if it is stationed in an apartment complex, it is easier. But home to home, when you carry, okay, you can carry and give it there, but who is monitoring? The patient who is on oxygen is a bit of a problem. So another good compromise will be, if they can afford it, they must hook on to the hotel stay where the nurse monitoring will be there for sure. But if at their own home, they can teleconsult the doctor. That's also.
Yeah.
But you can only take the responsibility of the supply, but you must make sure that they take the responsibility of connecting with their doctors for the further. Otherwise, it will be it will not be the right thing to do.
Yeah, a lot of people were asking yesterday and today also, for those who are living in independent homes, not in apartments, should perfectly healthy and fit people get a concentrator at home in advance, just in case?
It is quite expensive. It is about 55 to 60. 55 to 60,000. And
పెట్రోల్ చూడండి, నా దీంట్లో తక్కువ ఉంది. నీ దీంట్లో పెట్రోల్ అవుతుంది.
Sorry, is that okay? I just muted it. Yeah.
So I was just toying with the idea that if groups like BNP can collectively source some, and then it can be available on rentals on a telecall, that will be a better way of guiding them. But if they have the bandwidth to buy the oxygen concentrators, they must actually ideally lend it to people who need it, and then get it back when they themselves need it. That will be a worthwhile investment for those who can afford. They'll be helping others also.
Absolutely, doctor. Thank you so much. I think we have now run out of time. What we'll do is that the questions that we haven't answered, we'll just make a note of it, or perhaps we can just put it up as an FAQ somewhere and maybe do this session again sometime next week.
Yeah, the handbook version 2.
Handbook version 2, yeah.
Monica, can I suggest that anybody having questions can please post it on the group also.
Yeah.
It can be compiled, and Sandhya can compile it and send it to Dr. Hema Divakar, and then it can be answered.
Yes, yeah. So Sandhya, just copy all the questions that are there in the chat, and
Strangely, Shrikant, I'm not in that group. Please put me on the group.
Oh, you're not there. Yeah. Your husband is there on the group.
Yeah, Dr. Divakar is there. So I have to borrow his phone and look at what's happening in the group.
Okay. Thank you so much, Doctor, just for your generous time and inputs. I'm sure a lot of people benefited from it. Thank you. I think, Shrikant, unless you have something else, we'll close the meeting now.
No, we'll close the meeting. Thank you
Yeah.
so much, Dr.
Yeah, so handbook, a lot of people are asking. It is posted as a description to the group, and I think Sandhya will be sending a link to a lot of people. Yeah. Yes, Malini. Yeah. Thanks.
Yeah, so congratulations to BNP team again for their enthusiasm and their commitment. And we will definitely collaborate to do our best from our end too. Namaskar.
Thank you so much. Bye.